Hello, good evening, beloved fellows. So today I want you all to remember that we want to discuss, or I will be discussing elbow joint and bones, which forms the elbow joint. So let me share the screen with you. Have a look at the bones. Today in just in this recording, I want only you to focus on the markings of these bones. This is humerus, as it says, it's the right elbow, and it's the posterior view, anterior view in extension. The below one is the posterior. So this is in extension, the anterior view, and there are certain structures which are marked like 1, 2, and 3, and 4. So this bone is labeled radius, and this is labeled ulna. And this is just the right elbow and in extension, as you are seeing. This one is the posterior view. This is the posterior view in extension. And remember, up to 4 was there and marking. And this is again humerus. This is ulna. This is radius. Ulna is on the medial side. Radius is on the lateral side. Again, number 5, 6, 7, 8, and 9. These 9 structures which are in front of you, I want you, once you're looking at or watching this recording, I want you to write it down in comments after identifying each of these structures for the markings. What is attached here? And what is like, how is the elbow joint is formed? What type of elbow joint is what type of joint? What are the structures, both ligaments, muscles, capsule, whatever that you are familiar with, stru what structures strengthens the elbow joint. Okay, so you are looking at, or you are going to be revising and studying what type of joint is elbow joint, what are the structures which strengthen elbow joint, what are the movements which are possible at elbow joints, and all these identifying all these structures of radius, ulna, and radius, and humerus. What are these pointed structures? What are the clinical significance of these structures? One more one more picture I want to show you, because this is the view of the elbow joint in the extension. I also want you to look at the elbow joint or the bones forming the elbow joint in the flexion. And this is the 90-degree flexion. Right, so this is the lateral view, and there are 1, 2, 3, 4 structures which are pointed in number 1. I want you to identify those structures or be able to or familiarize with them so that you're able to identify them and point them out. And number 2, this is which bone is this? Because here in this image, there are no labeling. So I'm sure this is humerus. Which bone is this? Which bone is this? You have to identify, right? Moving down to the lower image. Again, this is the netter's anatomy, right? So up to 2 was there. This again is the same 2. This is again in flexion, 90-degree flexion, medial view. So that was the lateral view. If that is the lateral view, one has to be the medial view. This is the medial view. Medial view is towards the body, right? So this is number 3. What is number 3? Number 4. Identify the structure. If that is that bone, so that must be the, I'm giving it out, radius. So number 2 is radius. What is this structure? Maybe radial tuberosity. Yes, you have to find it out. Write it down. This is the exciting part. Number 5. Right. You're listening to it and you're identifying it. And for the sake of guesswork, you can write it down in the comments so that when I'll come across, I'll be knowing that you've been through the recording and you've listened to it and you have successfully identified. identified all of these structures which are pointed here. That's how we learn. Once you are familiarized with the markings, you'll be able to identify them, and in no matter how the MCQs are placed, you'll be able to solve them. And elbow joint is very important. In tomorrow's recording, I'll be giving out the answers of all the questions that I've asked you in this recording or in this video. Plus, we'll be discussing in the video after that one, the cubital fossa, how they form structures, contents, etc., etc. The importance as well. So with this, I want to end it here. Keep revising, keep reading, keep practicing, and that's how you'll make yourself perfect. Bye for now.